First, we want to define the extent and the severity of the disease. Once we know what type of Crohn's that patient has, then we discuss what are the possible treatment options. Our goal of treatment are twofold. First, we want people to feel great. We want the patient to feel well. And second, we want the patient to be healed inside. So we have a variety of different medications that decrease inflammation. For moderate severe Crohn's, we use our biologic and immunosuppressive agents. These are drugs that prevent our bodies from attacking our own intestine, so patients would feel better and they would heal inside. For biologic agents, we have different classes. We have our anti-TNFs, we have our anti-integrins, we have our anti-IL-12/23s, and then we have oral immunosuppressives, thiopurines, and methotrexate. So the anti-TNFs and the anti-IL-12/23s prevent inflammation, they're just blocking different pathways of inflammation. Whereas our anti-integrins work a little bit differently. They're a little more gut-specific or targeted to the intestine. And the way those work is if you imagine the cells that are causing damage in your body, that are causing inflammation in your body, are cars on a highway, and each exit off the highway is a different part of your body, your brain, your heart, your lung, your intestine. All these medications are doing is messing with the car's GPS so it can't get off the exit to your intestine. And some people with Crohn's, surgery might be the best option and one of the first options chosen for therapy. Symptoms are usually driven by two main things, either inflammation or swelling and something called fibrosis. And you can think of fibrosis as almost like scar tissue on the inside. All the medications we've been talking about, they all treat inflammation. So if somebody comes to the office that has a narrowing or a stricture that looks mainly scarred down, so doing surgery and just taking out that small piece of intestine, their symptoms will go away and they'll feel great for a very long time. Now, after surgery, Crohn's could still come back. So if you do have surgery for Crohn's disease, it's important to continue to follow with your physician to decide if you need any medication immediately after surgery or just following up with blood work and colonoscopies to make sure that disease isn't coming back. Working with your provider, there's no reason you can't live a completely normal life. Take whatever job you want, travel, have a relationship. It's just the most important thing is following up with your physician. But the vast majority of our patients do very well. And there are periods where symptoms may worsen, but overall they do very well long term.